topic today is the global health crisis in Yemen. Before we start, a little background about me. My name is Varshini Madhavan. I moved from Tamil Nadu, India before my sophomore year. I go to Marquette High School in St. Louis, and I'm a rising senior this year. Some extracurriculars I'm involved in is mock trial, youth and government, NHS. I was a volunteer at a rural school in India. This summer, I'm interning at KUTO, which is a crisis helpline for teens, and I plan on going into law in the future. Before we start, I'd like to reiterate what global health is. Global health recognizes that health is determined by problems, issues, and concerns that transcend national boundaries. It depends on international conflicts, politics, culture, environment, and economics.
So before we talk about the impact of the humanitarian crisis in Yemen and how global health is being affected by it, we need to understand why Yemen is in this situation in this first place. I split the history of Yemen's conflict into three phases: the Houthi movement, the international backlash, and the aftermath of it. The Houthi movement. In 2011, an Arab Spring uprising against the authoritarian president Ali Abdullah Saleh led to the president handing over power to his deputy. This political transition started the nation's downfall as President Hadi was forced to confront the jihadist attacks, corruption, unemployment, food insecurity, and most importantly, the continuing loyalty to the former President Saleh. The Houthis are a group that mainly support Yemen's Shia Muslim population, and they fought against Saleh in the previous decade. The Houthis soon gained support from the common people, both Sunni and Shia Muslims, and took advantage of President Hadi's weakness and tried to gain control. By 2015, the Houthis had taken over the capital Sana'a, and they attempted to take control of the entire country and eventually forced President Hadi to flee abroad. The international backlash of this. First of all, the coalition is a group of nations, including Saudi Arabia and other Arab nations, that tend to support Sunni Muslims. The coalition believed that the Houthi movement and Saleh loyalists were backed militarily by Iran. Again, Iran is a nation that has majority Shia Muslims. The coalition launched an air campaign with the goal of ending Iranian influence in Yemen and restoring Hadi's government. An important point to consider is that the US, UK, and France are supporting these Arab nations to end Iran's influence in Yemen and thus directly contributing towards the conflict. After 4 years of this war, Hadi's government was reinstated, but President Hadi still resides in Saudi Arabia and struggles to provide basic services for his citizens. What has happened since then? Terrorist organizations like Al-Qaeda and the Islamic State have both taken advantage of the instability and seized territory and carried out deadly attacks in Aden, Yemen. In 2017, former President Saleh was killed by his former allies, the Houthis. In 2018, the coalition captured a city called Al-Hudaydah, whose port is the primary lifeline for nearly 2/3 of Yemen's population. The UN even warned that doing so would cause a famine in Yemen that would be irreversible. In 2018, the Stockholm Agreement called for a temporary ceasefire. As of now, there is still massive instability in the region, and though Saudi Arabia announced a ceasefire due to the COVID-19 pandemic, the Houthis rejected it because the coalition still controls the port Al-Hudaydah. The human cost of this conflict. 12.3 million children are in need of humanitarian assistance. Over 2 million children under the age of 5 are malnourished. 7,700 civilians have died because of the coalition and the conflict there. And this is a number that's verified by the UN, but the actual deaths are estimated to be over 100,000. 85,000 children have died from severe malnutrition from 2015 to 2018. 20 million people in Yemen are dealing with food insecurity. Healthcare. Right now, Yemen is dealing with both the COVID-19 pandemic and the cholera epidemic. Though cholera is completely treatable, there are over 2 million registered cases of cholera in Yemen, and thousands have died due to it. Only 45% of hospitals are operational. Yemen is lacking sanitation, clean water, and healthcare facilities, which are vital in dealing with the pandemic. Healthcare workers haven't received pay in over 2 years. And as of now, there is an unknown number of COVID-19 cases because of the lack of testing. How can you help? As of now, what we as teenagers can do is donate. These are some of the organizations that are directly providing assistance, humanitarian assistance to Yemen. And if you need any more links, feel free to email me. These are some of the websites and articles that I visited to get information. And I'd like to acknowledge the GHLC team for giving me this opportunity. And I'd also like to thank Mira for helping me practice presenting. Thank you.